I'm Dr. Dmitrok Local by European Wellness Academy with title Xenogeneic Cell Therapy. Few words about the term SPF, specific pathogen-free. It refers to the laboratory animals from the closed colony. SPF animals are animals that are demonstrated to be free of a specific list of pathogens. And the germ-free animals are more properly referred to as Xenogeneic, meaning that they are free from all microorganisms, including those that are typically found in the gut, saprophytes, and even including the prions, free from all prions as well. Xenogeneic animals are produced by hysterectomy and must be maintained in isolation under very strict handling procedures to keep them germ-free. On the various stages of the culturing process, the type of the cells are identified and confirmed by particular staining and immunohistochemistry markers to ensure that the culturing is going on in the right direction and we obtain the type of precursor stem cells that is actually needed. Here are the microphotographs of the renal precursor stem cells in cell culture. Here are the pancreatic islet precursors in the cell culture. And the final look of the vials with precursor stem cells just right before they are dispatched from the laboratory. Following the implantation, precursor stem cells migrate to the site of the inflammation, injury, hypoxia, due to the chemoattraction by the chemokines and cytokines expressed by the inflamed or injured tissues. And further, these cells produce the biological effects, such as direct replacement and expansion of the cellular pool in a target organ and tissue, anti-inflammatory effects, increase cellular proliferation, improve microvascular density, reduction of fibrosis, attenuation of oxidative stress, and reduction of apoptosis. One of the most frequent questions I'm asked is about difference between the effects of the targeted stem cell therapy with fetal precursor stem cells and, for instance, the MSCs, which are non-primed, undifferentiated, pluripotent stem cells. As an answer to that question, I offer an analogy between a shotgun, which has a short range of effect with a scattered, disseminated fire, versus the sniper rifle, which has a much longer range of successful aiming and high precision of hitting the target. I'm Dr. Dmitrok Local by European Wellness Academy with title Xenogeneic Cell Therapy. Now let's look at the published data regarding safety and efficacy of xenogeneic cell therapy. One of the first published evidences in the modern medicine, meaning not older than 20th century, is from Germany by Dr. Küettner, who in 1912 published an article about xenotransplantation of thyroid cells to the patients with hypothyroidism. Later, in 1927, Drs Kurtzahn and Hübeener reported similar studies of implantation of thyroid tissue via injection in the treatment of children with myxedema. Both publications reported regarding safety, absence of severe adverse reactions, and reported significant efficacy of this type of therapy. Needless to say that following these reports, xenogeneic cell therapy became widely used in Germany, Austria, Switzerland, and was practiced on rather huge scale in Western Europe during the entire 20th century. The most prominent names: Paul Nijans, Franz Schmidt, Professor Albert Landsberger from Heidelberg University, and many others, like Dr. Sauer and Dr. Antmann from the German Cancer Research Center in Heidelberg, along with Dr. Westphal. They all use xenogeneic cell extracts made from the fetal liver for stimulation of senescent fibroblasts, the connective tissue cells, to promote them to start dividing again. I'm Dr. Dmitrok Local by European Wellness Academy with title Xenogeneic Cell Therapy. Dr. Carl Gustav Groth from Stockholm, the Karolinska University Hospital in Sweden, treated type 1 diabetic kidney transplant patients with fetal porcine islet-like cell clusters injected intraportally or placed under the kidney capsule of the renal graft. Some of the patients excreted insulin during from 200 to 400 days following their transplantation. Rafael Valdes from Mexico City, David White from Ontario, Canada, and Diantraz, the company based in Auckland, New Zealand, in May 2001 reported the transplantation of islets from 1-week-old piglets mixed with the testicular Sertoli cells to 12 children aged from 10 to 17 years with type 1 diabetes. 5 of the patients required less insulin, and all of them received additional islets at 20 weeks. During a follow-up extended for more than a year, one of the patients, a 17-year-old girl, did not require insulin anymore at all in life. Terrence Deacon from Belmont, USA, transplanted fetal porcine dopaminergic neural cells into the brains of 12 patients with Parkinson's disease. At the post-mortem of one of the recipients who died much later after the transplant, the surviving xenogeneic neurons were identified 7 months after the transplantation. Patrick Aebischer from Lausanne, Switzerland, transplanted encapsulated bovine chromaffin cells from newborn calves to the spinal canals of the patients with ALS and severe pain. In 1998 and 1999, a placebo-controlled blind study sponsored by the American company Cytotherapeutics was performed in Poland, Czech Republic, and Switzerland on 85 patients with quite impressive results and good success.